Picture this. You are sitting at your kitchen table. Your coffee is still warm. The morning is quiet. And then,
Don't.
one
I can't
hand
move
stops
it.
working.
What's happening? Why won't it move? What's wrong with my hand?
Not pain, not a loud alarm, just a hand that suddenly feels like it belongs to someone else. In my neurology clinic, I have seen what happens on both sides of that moment. I have sat with patients who acted, and I have sat with patients who waited. The difference is stark. My name is Dr. Anika Mehta. I am a neurologist, and in the next few minutes, I am going to give you a 3-minute protocol, grounded in biology, that you can use alone, frightened, and uncertain. Not theory, not a pamphlet, a real sequence of actions that works with your body's own physiology to protect your brain while help is on the way. But first, you need to understand what is actually happening inside your brain in that moment. Because once you understand the biology, everything I am about to tell you will make complete sense. Think of your brain's blood supply like a garden hose. When the hose is open and flexible, water reaches every corner of the garden. Now imagine someone steps on that hose. The garden downstream doesn't die instantly. It starts to wilt. That wilting, that threatened but not yet dead tissue, is exactly what we are trying to protect. When an artery supplying part of your brain becomes blocked, a small zone at the center of the blockage loses blood almost immediately. Those cells are in serious danger. But surrounding that center is a ring of tissue, what neurologists call the ischemic penumbra. This tissue still has some blood reaching it through neighboring vessels. It is struggling, but it is alive. And it can stay alive long enough for treatment to work, if you do the right things in the first few minutes. Here is what makes this urgent. Brain tissue does not have much reserve. It runs almost entirely on oxygen and glucose delivered through blood, and it has almost no backup supply. When blood flow drops, neurons begin losing function within seconds. Not minutes, seconds. Every minute of untreated blockage costs roughly 1.9 million neurons. That is not a metaphor. That is a measurable biological rate. Now, your healthy brain has a remarkable self-regulating system. It can widen or narrow blood vessels automatically to keep flow steady across a range of blood pressures. But during a stroke, that system breaks down. The brain loses its ability to self-correct. And this is the critical point. Your body position and your breathing pattern suddenly matter enormously because the brain can no longer compensate for the wrong environment. This is also why I want to talk about something called a TIA, a transient ischemic attack, sometimes called a mini-stroke. I will come back to this in detail later, because what most people get wrong about a TIA is more dangerous than the TIA itself. For now, the biology matters, but knowing what is happening is only half of it. The other half is knowing exactly what to do about it, in order, before fear makes that decision for you. So let's get into it. Here is what you do. The moment something feels wrong, a hand that isn't responding, a word you suddenly cannot find, a strange heaviness on one side of your face, the very first thing you do is stop moving and get low. Not in a moment, right now, immediately. Here is why this matters biologically. A brain that is losing blood flow is also losing motor coordination. The signals your cerebellum sends to keep you balanced, to catch yourself when you stumble, those signals depend on the same blood supply that is now compromised. You may feel steady. You may think you can walk to the phone, or to the front door, or to the couch. And then your legs simply give way. For a senior, A fall during a stroke is often more damaging than the stroke itself. A fractured hip, a head injury from hitting the floor. These complications can permanently change the outcome of an event that might otherwise have been survivable with good function intact. So the rule is simple. The moment something feels neurologically wrong, sit down. If you are already seated, stay seated. If you can safely lower yourself to the floor with your back against a wall or a piece of furniture, do that. The goal is not a perfect position yet. The goal is to remove fall risk from the equation entirely. Now, step 2. Call 911 before you do anything else. I know what some of you are thinking. You are thinking, I do not want to bother anyone. I am not sure this is serious enough. Maybe it will pass in a minute. I have heard this from patients more times than I can count, and I understand it completely. Many of you grew up in a generation that pushed through discomfort quietly. Calling for help felt like admitting weakness. But I need you to hear this clearly. Calling 911 is not the last resort. It is the first action. Because the moment paramedics are dispatched, something important happens that most people do not know about. They can pre-alert the hospital. They can send ahead the information that allows the stroke team to be ready when you arrive. Imaging equipment prepared, the treatment team assembled. That single phone call can cut the time between your arrival and the start of treatment by a significant margin. And in stroke medicine, every minute of that margin is brain tissue that either survives or does not. If speaking is difficult, and it may be, call anyway. Stay on the line. Dispatchers are trained to work with incomplete communication. They will find you. While you are on the call, or immediately after, there are 2 more things to do with your body. If you can do so safely from where you are, lie flat on your back, not propped up, flat. The reason is gravity. When you are sitting or standing, your heart is working against gravitational pull to push blood up to your brain. When you lie flat, that gravitational burden disappears. The heart does not have to push uphill. Blood can reach the brain with less effort and less pressure loss along the way. And then, if there is anything nearby, a folded blanket, a cushion, a pillow, place it under your legs to raise them about 12 inches off the floor. This is venous return. Blood that has pooled in your lower limbs begins moving back toward the heart. The heart receives more volume, pumps more effectively, and your brain gets more of what it is starving for. Now note the time. Say it out loud, even if you are alone. Now here is the part most people never think about, and it may be the most powerful thing you can do while you wait. Your breath. Here is something most people would never guess. The instinct almost everyone follows in a frightening moment. Breathing faster, pulling more air in, is one of the most damaging things you can do during a stroke. Not because it feels wrong, because it feels right. And that is exactly what makes it dangerous. When you breathe too fast, you push carbon dioxide out of your blood faster than your body produces it. And carbon dioxide, despite its reputation as a waste gas, plays a critical role in regulating your blood vessels. When carbon dioxide drops too quickly, the smooth muscle lining your cerebral blood vessels contracts. The vessels narrow. Blood flow to the brain, already compromised by the blockage, gets reduced further by the very act of panicking. So here is what you do instead. And I am going to give you the exact numbers right now, because under stress, you do not have time to remember vague instructions. Inhale through your nose for 4 seconds. Hold for 2 seconds. Exhale slowly through your mouth for 6 seconds. 4 in, hold 2, 6 out. That is it. That is the pattern. Run it continuously from the moment you are on the floor until the paramedics walk through your door. Now let me tell you why it works, because I want you to trust it enough to actually do it when you are frightened. The extended exhale, that slow 6-second breath out, activates the vagus nerve. Think of the vagus nerve as a long communication cable that runs from your brainstem down through your chest and into your abdomen. When you exhale slowly, you stimulate that nerve directly. It responds by shifting your nervous system away from the fight or flight state and toward what we call parasympathetic dominance. Your heart rate slows, your blood vessels relax, your blood pressure begins to stabilize. Research on slow breathing, at approximately 6 breaths per minute, which is exactly what this pattern produces, shows measurable reductions in blood pressure and meaningful improvements in how well the brain regulates its own blood flow. This is not relaxation advice. This is vascular medicine you can perform with no equipment and no training beyond what you are learning right now. There is also something important about the nasal inhale. Do not breathe through your mouth. Nasal breathing warms and filters the air, and it naturally slows the rate of inhalation. Mouth breathing tends to produce faster, shallower cycles that undermine the whole pattern. So nose in, slow out, every cycle. And do not force it. Do not try to take the deepest breath of your life. The goal is not volume, the goal is rhythm. A slow, steady rhythm that tells your nervous system the danger is manageable, that your body has not given up, and that you are still directing what you can control. When everything else feels out of your hands, when your arm is not obeying you and the words are not coming, your breath is still yours. You can direct it, and directing it is protecting your brain. Combined with lying flat and legs elevated, this breathing pattern creates the best physiological environment your body can produce without medication or equipment. Position works with gravity. Breath works with your nervous system. Together, they are buying time. And time, in stroke medicine, is everything. But here is what most people miss. Some of the most dangerous moments are not during the stroke. They come before it, in quiet warning signs that look like nothing. Now I want to go back to something I mentioned earlier, because it may be the most important preventive information in this entire video. The TIA, the mini-stroke, the 60 seconds of numbness that disappeared and left you wondering if you imagined it. You did not imagine it. And it was not nothing. Here is what actually happens during a TIA. A clot briefly blocks an artery supplying the brain. Symptoms appear, the clot shifts or dissolves on its own, and the symptoms clear. The brain recovers. But the conditions that created that clot are still there. The vessel wall that allowed it to form has not changed, and the risk of a full stroke in the hours and days following a TIA is genuinely significant. So I want you to know how to check yourself. Run through this quickly whenever something feels off balance. Did you suddenly feel unsteady while sitting still? Not from standing up too fast, but from nowhere? Eyes. Did your vision blur or go dark in one eye briefly? Face. If you smiled right now, would both sides of your mouth move equally? Arms. If you raised both arms in front of you and held them there, would one drift downward on its own? Speech. If you tried to repeat a simple phrase, would the words come out clearly? Any one of these, appearing suddenly and for no clear reason, is a reason to act. Now here is the distinction I need you to carry with you. Dizziness when you stand up quickly is common. It is called orthostatic hypotension. Your blood pressure briefly drops when you change position, and it self-corrects in seconds. That is benign. But dizziness while you are already seated, especially alongside any other symptom, a numb hand, a strange sensation in your face, a word that suddenly will not come, that is a red flag. Those combinations matter. Seniors most often dismiss these warning signs by attributing them to something familiar. A heavy arm must be the arthritis flaring. A moment of confused speech must be tiredness. A brief visual disturbance must be the lighting. I understand that impulse, but the brain does not produce these symptoms without reason. When they arrive suddenly and together, they are not aging. They are biology asking for your attention. I also want to mention stress, briefly, because it belongs here. Chronic stress raises cortisol over time, and elevated cortisol damages the walls of blood vessels. This matters because a vessel wall that has been under long stress is more vulnerable to the kind of event we have been discussing. Calm is not just emotional, it is vascular. So here is my practical ask. This week, not someday, this week, lie down on the floor, place a pillow under your legs, and run through the 4-2-6 breathing pattern for 2 minutes. Practice it while you are not frightened. That is how muscle memory forms. When the real moment arrives, your body will remember before panic has a chance to take over. But there is one more thing I need to tell you, because protecting your brain in a crisis and protecting it quietly over years are not the same challenge. The difference between permanent damage and meaningful recovery often comes down to what happens in the 3 minutes before the ambulance arrives. Down, flat, legs up, breathe slow, call first. That is the protocol. That is the sequence your brain needs from you. But here is what I want you to sit with. A stroke is a vascular event. It happens in a moment. What concerns me more, as a neurologist, is what can happen slowly, quietly, over years, while you feel completely fine. Because sometimes the same conditions that raise stroke risk are already doing something else in the background. Something that most people would never connect to vascular health. There is a memory test, not the standard one your general practitioner runs through in a routine appointment. A different one that is specifically designed to catch the earliest cellular changes before symptoms appear. Most doctors never order it. Most patients never hear about it. If you just spent time learning how to protect your brain in a crisis, the next logical step is making sure you understand what may quietly be working against it right now. That video is on your screen. Watch it next.